So lead us into how Paytient solves that problem of affordability.
So yeah, thank you. I can characterize it in the following way, right? People put off care for kind of two, if you think about it from the financial side, there's kind of two angles to it, right? One is you just look at it and you say, hey, I don't care how much this thing costs. I know I can't afford this. There's some set of people, and particularly folks in sort of lower socioeconomic groups in the country, where the problem is truly at that level, right? It almost doesn't matter what the price is. I can't afford it. For a lot of folks in the country, it's compounded, or the affordability problem is compounded by this like lack of transparency in the pricing, where it's this question of like, I might be able to afford it, but every time I get a bill, I never know what it's going to be. I certainly don't know in advance. It takes sort of 90 days for the claim to get adjudicated and show up. And if that bill ends up being more than, for the sake of argument, $200, then I have a problem. Because of that uncertainty, I'm going to put that off. And so there's kind of two ways where that cost as a barrier to care thing plays out. I think for most people in this country, it's probably folks in that second bucket, but we think sort of the way we're trying to approach the problem solves both of those. And so the approach is one where, whether it's through your employer or through your health plan that's providing the health insurance that you have, we're going and we're saying to folks, hey, we're going to put money in your hands that you can use for healthcare kind of broadly defined.